Chief Technology Evangelist. We're here at Rackspace Technology. On the road, folks, I'm coming to you live from Boston, Massachusetts today. Snowy Boston. Holy cow, I'm not in Texas anymore. There's snow outside that window. It's cold. The wind is blowing. These are things I'm not used to as a Texan, but hey, we'll power through. But now I'm coming to you live from the lovely where am I? I'm in a Residence Inn here in downtown Boston, Massachusetts. So very glad to be with you today. Hey, doesn't matter where I am, doesn't matter if it's snowing, doesn't matter if the sun is up, if it's Tuesday. Well, I'm here to bring to you some amazing content. Folks, as you know, this program is part of our thought leadership program here at Rackspace called Solve. And I'm so glad that you're here today. So if you would do me the favor, some of these things still don't change. I'd love for you to introduce yourself. Tell me who you are. Tell me where you are, because you're going to get the opportunity to be a part of the conversation. Hey, first person's here. We're glad that you are. And introducing yourself quite nicely. And Josh put him, or Daniel put him up down there. And so if you want to get a hold of us, folks, maybe even outside of communicating or talking to us during the program here today, well, I'd love for you to send an email over to us at solve@rackspace.com. Comes to the whole production team. Daniel gets it. Megan gets it. I get it. If you've got any feedback for us, you want to bring us, any ideas for a show, maybe you've got a criticism you want to bring, would love to hear that as well. Hey, looks like Taib is here with K&H Global IT Solutions. Glad that you are here. Hey, he's got information. Looks like Taib is selling today. Glad that you're here. All right, and Todd's here. Todd's just down the hall. I'm here in Boston with Todd. So our conversation today, as you've seen, as registered as part of this event, whether you're coming to us on YouTube or you're coming to us on LinkedIn. Hey, Michael's back. Glad that you're here. Is all about, in fact, these last Tuesdays of the month tend to fall into the whole topic of technology focused in and around the healthcare vertical. And today is no different. So I have brought back my partner in crime from the Chief Technology Office. We have got Vinesh Kolpa here. He is he's got years of experience in both the healthcare industry as well as, of course, super brilliant when it comes to the technology. And then we've also brought along Josh Stern. Now, Josh is the Chief Revenue Officer over at Vatica Health. And the topic we're going to get into today is exploring the benefits and challenges of value-based healthcare in this digital age. But before we do that, I've got to call out Julie here as well. Normally, Julie is looking after us as part of the Office of the CTO here at Rackspace. Julie, I'm so glad that you are here. She is Chief of Staff over there, just crushing it. John Deegan, another person who I'm here in Boston with, is here. We've got Ayan here, and Phil. Phil, I'm so glad that you joined us here today as well. All right, well, enough of the preamble. Let's get into the topic, because I'm super interested to learn more, and I know you are, about value-based healthcare. So let's bring up Vinesh and Josh onto stage. All right, and here's everybody. So Josh, it looks like you've got a winter wonderland not unlike my own here in Boston.
I am used to the winter wonderlands. I know you're a Texan. I'm a Connecticutian, so used to this, although we've had a pretty calm winter. And nice plug for a Residence Inn by you, Jeff.
Indeed. So Josh, you're Chief Revenue Officer over at Vatica Health. First of all, tell us, what is a Vatica Health? What is the focus? And then tell us a little bit more about your day-to-day.
Yeah, so as you said, I'm the Chief Revenue Officer at Vatica Health. We're tech-enabled services, and we really sit kind of between providers and health plan insurers, or more broadly, at-risk entities. And we focus on risk adjustment and quality of care, which we'll get into for those of the people that don't really know that. But those are two of some of the most highest weighted factors and variables in order to be successful in value-based care.
Very good. All right, thanks so much. And Vinesh, you are no stranger to the program, but why don't you introduce yourself and tell us a little bit more about what your day-to-day is like here in the Chief Technology Office at Rackspace, but maybe a little bit more about your background.
Sure, Jeff, excited to be here and excited to have Josh here, who's been a mentor and a friend. We worked at HMS before. It's been a couple of years now, but grateful that he's here. My background, again, with Rackspace now for a couple of months, working in the office of the CTO, helping us advance in the healthcare sector of things. And then also prior to that, about 22 years working in healthcare, across payers, providers, and then cost management companies. So excited to be here.
So glad that you are. Okay, now a topic today, of course, as I've mentioned, is it is all around value-based healthcare. So before we can get into talking about the benefits and challenges of it, I think we should define exactly what it is. So maybe we'll give each of you a shot at this. But Josh, I'll start with you. Value-based healthcare. You're in the business. What does it actually mean?
So, healthcare, we love our terms, and, the terms take on a life of their own. So I think it's a good question. So I'll try and define it as simply as possible. So value-based healthcare is nothing more than a shift, right? And I use the word shift, which we'll get into, which is important, from incentivizing and paying providers based on the service they deploy, so the number of services they deploy, and shifting to more rewarding and incentivizing for the outcomes they achieve or the efficiency by which they achieve. And I think framing is helpful here. So, a few metrics, right, which I think speak to the why. US spends around 18% of our GDP on healthcare. We spend $4 trillion and around $13,000 a person. So that's projected to continue to ramp up. So obviously a problem to solve because it's not sustainable. And value-based care and the shift to value-based care is viewed as a way to help solve and quell that problem.
Oh, super interesting. All right, Vinesh, you're the one who said, "Hey, Jeff, we should talk about value-based healthcare." So how do you define it?
Josh did an amazing job there, right? I think simply put, it says, look, if you pay for 5 things, and it takes you 10 things to keep a patient healthy, you don't get paid for the other 5. Now, that's a very financial way of looking at it, but it's really, it's the shift from fee for service or volume to value. And it's a new model which states that, the dollar allocation that the market is prepared to pay for healthcare in America should be based on who provides the most value at the best quality and the best outcome. And really what that tends to do is put the payer, the provider, and the consumer on the same side of the table, where they are incentivized to drive better outcomes for the patient and then share the economic incentives with both the payer and the provider. So it's really this shift that we are seeing. And it's not new, right? We saw this bundled payments 10 years ago. These things have evolved. And, we like to, like Josh said, we like our acronyms. So they come up with these things every few years. So.
Well, I love how you put that, moving from volume to value. And it really is, I would think, a pretty substantial shift, especially on the provider side, who's really rethinking, what do their practices look like? What does their care look like? And now driving more towards, what is the value that we're driving out of that? But we're talking about this from the benefits and the challenges. So obviously, Vinesh, you also pointed out the fact that it puts the payer, the provider, and the patient, that's a lot of alliteration, in all driving towards the same thing. The ultimately the patient wants to be healthy. They want to be, they don't want to have the disease. They don't want to be unhealthy. And it puts them aligned with a provider who's going to be able to do that and make sure that provider is getting paid and compensated appropriately for it. But Josh, as we think about the chief revenue officer over at Vatica, how has that shifted, or influenced how you guys are operating as a business?
Yeah. So when there's any disruption in industry or there's usually an event, right? As Vinesh mentions, value-based care is not new. I think the uptick and the acceleration of value-based care is really why it's so prominent and prevalent in the news. And I think part of that and the undercurrent is COVID. So when COVID hit, people stopped going into the office, they hunkered down, procedures, surgeries, proactive healthcare, everybody just stopped. And the reason why that's important to understand is in the traditional fee-for-service model, right, which we're working to shift from to value-based care in our country, right, volume equaled revenue. When there was no volume, it put a major stress on independent physicians, medical groups, hospitals, and that became the inflection point and the accelerator to really understand, okay, this is real. I have to think about doing things differently. This is not going away. And it really became, the match, if you will. And you start to see that in CMS too. So CMS has just rolled out the ACO REACH program, which is highly, highly anchored to value-based care from a provider standpoint. So CMS is always a very good proxy for the different models that they're experimenting with, because it's showing their card, so to speak, of where they're trying to shift everybody. And there's a bunch of stats out there. By 2030, they hope 80% of Medicare Advantage members or Medicare members overall are in some sort of value-based care arrangement.
Okay.
More specifically at Vatica, because we sit as middleware or bridges between payers and providers, this has really created a new concentration and need for transparency of data, technology, access to information. So both parties, Vinesh mentioned this in terms of trying to align the stakeholders within healthcare, at-risk entities, providers, members, the same view into the data so everybody can build trust, right? I think change is really hard. Some of the barriers to change is trust and feeling like everybody's at the table with the same information and partnering together so everybody is win-win-win. The old adage in a negotiation, if somebody feels like they truly lost, nobody won. That's really the juncture that we're in right now.
Got it. Talk a lot in technology about the fact that the technology tends to be the easy part, and the hard part really becomes getting, individual buy-in into whatever that new technology bit is. And as we go through this transformation into value-based healthcare, it's interesting that you talk about the biggest challenge being in and around trust. It gets back to, are the individuals feeling like their needs and their needs are really being met, whether it's any of those three in the arrangement. But let's dig into the digital part of all of this. How is technology helping to advance this? So Vinesh, maybe over to you. Where does technology fit into this, and how are maybe those three different constituents, the patient, provider, and payer, how is it impacting each of those?
Again, firstly, I would like to, shout out a few of my ex-bosses are here. Kim,
We've got some friends.
Phil, from HMS. So thank you for joining. So, from a digital health standpoint, again, Josh mentioned COVID, right? So, as I like to say, COVID was the biggest accelerator that we saw, which was accelerator for technology there, really. And we saw this huge uptick, right? I think I read something like 4,000% increase in telehealth visits, right? And we now that's become a norm. So if when you look at telehealth, I look at it from three standpoints, right? One is the synchronous, like the one we are in now, right? Yeah. And the second is really the store and forward. So imaging, right? Now we are able to exchange images, which require a different infrastructure. It requires a different multi-cloud approach to it. And then last but not the least, it's the remote patient monitoring, right? It's around how do we keep the people at home? So, the whole thing around from hospital to hospital, right? It's all about, the digital front door, but also we need to realize where does that digital front door lead to, right? Yeah. So it's really all about leveraging these, remote technologies. And it's not just one technology. I like to say that, it's really a convergence of technologies, right? So it's AI. There's the famous quote, right? It's not that the doctor is going to, the AI is going to replace the doctors, but doctors who use AI are going to replace those who don't. So it's really that convergence and the drive towards, just accuracy as well, right? Because, if you're using these devices, how accurate they are. I read somewhere the other day, it was saying, well, there's a AFib machine, which is around 67% accurate. Well, if I'm in an ICU, I'm not going to rely on that. I'm not going to be too comfortable with that, right? And no clinician is actually going to base a change in practice based on that data. So it's really those challenges, but also the convergence of technologies, in my view.
Yeah. So Josh, maybe over to you. How, obviously technology plays a big part in the things that you're doing. Data plays a big part of it. We're going to go down the rabbit hole shortly, maybe even deeper into data. But, maybe over to you. How is technology, both the benefits and the challenges of it, impacting what you guys are up to at Vatica?
Yeah, I think for anyone, right, technology is obviously an accelerator. It solves a lot of problems, but you really need to know what to point it to, right? Like technology is a deployment and a vehicle, if you will, or a delivery mechanism. But if you don't know what you're trying to solve, you get into this circular vortex, right? And like we talk a lot about that, at our organization in terms of product development and rolling out products. And I think it's very easy. It's like, oh, if we just had this technology, we could do this. It's like, well, step back. What are you really trying to solve? And Vinesh gave some real practical use cases within COVID, right? Telehealth, obvious practical vehicle of technology, right? People can't go into the office. So how are you going to render services? Get a multimodality platform with, audio visual synchronicity, right? Things like that. Obvious patient remote monitoring. So it's, how do you think about solving the problem first? And maybe in a bootstrapped way or an entrepreneurial way, prove the thesis and the outcome, and then wrap and shop for technology to create scale, if you will. So that's how we think about it. And we think about it as kind of additional ways to scale, access to data, putting everybody at the table with the same visibility, more real-time results, right? I think one of the things that you hear a lot in healthcare is you don't really know how you're doing until like a year from now. How can you get better and self-reflect and look at what you're doing, making an impact if you don't know if that impact has moved you up and to the right, until a year later?
Yeah, a year is a pretty long buffer time to know if you've made a right turn, whether you've gone left or right, if that's creating a benefit to it. So what's keeping from that feedback loop being tighter? Is it access to data? Is it just the response of folks changing their business models, providers changing business models? What is it that's making that feedback loop be so long?
Yeah, so it's the typical things I think you see in most industries, right? When you're going through disruption, there's a bunch of disparate systems. There's lack of standardization. I emphasized the word shift earlier. We're in this shift to value-based care, right? So there's multiple complex contracts and dynamics between at-risk entities and providers, right? Health systems. The CEO of a hospital now is basically a mini insurer. So people are taking on different risks. There's upside only, there's downside, there's global risk. So I don't think we want to get too far into that dynamic, but based on where you are in the paradigm, you have either infrastructure set up or lack thereof. You don't have kind of the real insight of large data sets to understand if something is working or not working. And you don't really know how that is influencing what you've just taken risk on until later on. So it's a confluence of things. And then, throw in the fact, just from the core system that most health systems and providers use are electronic medical record systems, right? So EMRs, there's all sorts of different EMRs. There's different instances within the same EMR with different modulars, right? So it's just everybody's doing different things at different times because there's this shift of standardization.
Right. So really great call out the fact that we haven't arrived there. We're in the process of the transformation. There are a million moving pieces, and a lot of those pieces are behind different software, I'll call them walls. And even once you get inside of one, there are multiple points of inflection as well that create that challenge.
But Vinesh, if I could just add in the behavioral component, right? Like providers go to medical school to be diagnosticians, right? To take care of their patients. And then now they're being asked to do different things, very important things, but different things, not necessarily what they were trained to do. And then take us as consumers, we largely consume healthcare very reactively, not proactively. And that's a big component of what value-based care is trying to do, which is shift the behavior, not only from a clinician and provider standpoint, but also from a member standpoint. How do we consume healthcare and be proactive in taking care of ourselves, rather than we get sick or something hurts and then we render a service?
Well, it's a great point. We know the old adage, an ounce of prevention versus a pound of cure. So how do you change behaviors from a patient point of view, from an individual? How do you get them to be, like me, I just took my vitamins, I did my exercise today. These are the things that ideally are going to keep me out of out of a hospital at some point, or at least delaying that as much as possible.
Yeah, I think some of it's time, right? Some of it's time, some of it is generational. I think people aging into Medicare now, for instance, are very used to technology, right? I think there's going to be a real need and standardization of multimodality in terms of getting care in the home, choosing to get care in the home because maybe you don't need it, but you want to solve for time, or going into the office. But the real answer, right, it keeps coming to value-based care. So value-based care incentivizes efficient outcomes and deploying the right services at the right time. So providers are going to be incentivized to outreach to the population that they're responsible for. And that outreach, whether it's, member engagement, hey, Jeff, you haven't had a physical in 2 years. It's time to schedule a physical, and here's why it's important. Things like that will just change in time, because at the end of the day, incentives drive behavior.
Very good. So
Yeah,
Vinesh,
and sorry, go ahead.
no, it's just, you obviously have, I want you to add into
No,
this.
this is like Jeff said, Jeff, like Josh said early on, we can talk all day about this, but really, the reimbursements is another piece, right? For example, remote patient monitoring, right? Medicare doesn't pay for it. So when you're taking full capitation risk, how do you, again, incentivize the patient to, be healthy, like that whole progressive model, right? For cars, the better you drive, the lower your premiums, the more healthy you are, your premiums could be. So there could be some new, and there are, I know, changing models on how to incentivize the member, and also obviously behaviors, and how do you meet the member where they are, right? The whole social determinants of health aspect. Because I was looking at zip codes, in Dallas, there's a zip code where the life expectancy is 57 years. About 3 miles down, it's about 83 years.
Really?
So there's a 27-year, life expectancy gap just based on zip codes and the whole population and communities there. So really, it's a convergence of all of those factors that will drive, the adoption.
You hit a key thing. I think for the first time, you're really starting to see the system, if you will, right? The government understand healthcare just doesn't only take place in the office for the rendered service, right? You hit on social determinants of health. That's a fancy way of saying, does somebody have a car? Can they get to where they need to go to get healthcare? Does somebody have a house to sleep in, right? Obviously, you can't keep somebody healthy if they don't have a roof to sleep in the Northeast. So I think there's a real understanding, right? You hear total cost of care, you hear population health, you hear consumerism. All that means is just the broadening view that healthcare doesn't just happen face to face with your doctor in the office. It's really a whole kind of view of how does one get the right funds, the right assets, the right support, the right education to truly be healthy, which ultimately drives what I started with in terms of those framing metrics of 13,000 per person, $4 trillion, 18% of GDP. It starts to kind of plateau that cost curve.
Wow, super interesting. Obviously, we could use a few more hours to truly unpack all of this, but I want to wrap this up as we hit towards the top of the hour. But know that as generally speaking, a consumer in this space, it sounds like just the right thing to have happening. I love the fact that we're measuring providers and such not based on the amount of things they can crank through the machine, but the quality of the lives that they're helping to create in the individuals that they have been entrusted to care for. That's the right thing to do, but it also helps, empower us as individuals to take ownership of that as well, and to make our providers maybe their job a little bit easier when we think about wearables, or we think about other ways to track our health in a digital construct, and making that data available to the system to be able to help guide and care for us as individuals, but also as communities. Josh, you make an amazing point. It's really hard to keep somebody healthy if it's a snowstorm and they don't have a roof over their head. So there's some really interesting real world challenges to be dealt with here. But back to Vinesh's point from really early on, and I think he mentioned it when we visited last month, and that is AI, or I'll just even say technology at large, is not going to take over and put providers out of business, but those that do consume it will maybe be the ones who survive this transformation to a value-based, digital-enabled construct. So, gentlemen, thank you so much for being a part of the program today. It's always fascinating to go down the rabbit hole into a specific industry like this and see how technology is enabling it, how in some cases it could even be an impediment, but where the opportunities are. And in this case, to increase the quality of all of our lives and maybe drive down that $13,000 per individual down to 12, 11, 10. And that could, Josh, so real quick, last question, Josh, how much of that is personal responsibility in hey, I have a Bostonian here with me, to helping driving that number down, making sure that I get my physicals, making sure that I take my vitamins, making sure that I am getting the exercise that I need?
I think a lot, right? It's everybody chipping in and viewing healthcare as a consumed service, just as, these are probably bad comparisons, but to start to think this way as a consumer, the same way you shop for clothes, right? And you decide on value. And there's obviously things that need to come into play in terms of price transparency and what you're going to get in terms of a quality outcome. But it's starting to shift the mindset of becoming more proactive, which change is always hard and time is hard to find. But, it's a cultural shift across the board, through all stakeholders.
Indeed it is. All right, gentlemen, thank you so much for being a part of the program today. And folks, next week we have a great episode I want to just do a quick call out for, and that is it's the first Tuesday of the month. And you know what that means? It's Women in Tech Tuesday, but we're heading into March, and every guest during the month of March is going to be an amazing woman who's doing incredible stuff inside of tech. So you're not going to want to miss us next week. We have Sarah Hollingsworth. Now, Sarah she's an old school racker from years ago, but she went on to become a founder of what's becoming quite an amazing, successful, data-driven business. So you're going to want to be a part of this next Tuesday. So look for that event on our LinkedIn page over at Rackspace, and make sure that you're here next week. But otherwise, Josh, thank you so much for taking time out of your day. And Vinesh, always good to see you. And by the way, when we come back together for healthcare next month, end of the month, Vinesh and I will be live in Nashville. If you're going to the event out there, at the Rise event out there, look for us. We'd love to see you. All right, everybody. For Rackspace, my name is Jeff DeVerter. I'm the Chief Technology Evangelist here, and we'll be back next week with another episode of Cloud Talk Live.